Nurses are, of course, needed to help handle the surge, but issues surrounding the pandemic could force hundreds of them in our area to the picket line. Eyewitness News reporter Greg Argos is in North Philadelphia to tell you why the nurses are poised to strike. Greg?
Yuki, good evening. This is all over one major issue at 4 separate hospitals throughout this area, including St. Christopher's Hospital for Children. And if it is not resolved, well, that could mean thousands of nurses throughout Philadelphia and this region could walk off of the job.
The nurses run the hospital. We are the heart and soul of the hospital.
If that's the case, very soon 4 hospitals in our area could be on life support, as 2,500 nurses represented by the Pennsylvania Association of Staff Nurses and Allied Professionals, or PASNAP, prepare to go on strike.
Without the nurses, the hospital would not run.
Sue Swift is a registered nurse with more than 3 decades of experience. She also represents nearly 500 nurses at St. Christopher's Hospital for Children in Philly. Her nurses, along with those at nearby Einstein Medical Center, St. Mary's Medical Center in Bucks County, and Mercy Fitzgerald in Delaware County, have already authorized a strike.
I think for all the hospitals, they would all agree that staffing is their #1 issue.
Maria Plano is also a nurse at St. Chris's and the union's vice president.
Nurses are stretched so thin, and they're not able to, get where they need to be. And I know that this is happening at Einstein. I know St. Mary's, this is, the #1 issue. Mercy Fitz, staffing. We need some kind of guidelines where nurses are in the discussion and helping to make the decisions.
And now with the increase in COVID-19 cases throughout the region, there is concern about how improper staffing could affect care.
They don't have the nurses that they need to care for, and they are getting an influx of these COVID patients. They did when this began, they did over the summer. Maybe it weaned off a little bit, but now we're surging right back.
We reached out to public affairs for all 4 hospital systems. The only to respond, Einstein Medical System. A spokesperson there writes in part, quote, "We're currently in the middle of negotiations with our nurses and currently have no further comment." So where do we stand right now? Well, nurses at all 4 of these hospitals have authorized the vote to strike. That means after giving the proper 10 days notice to hospital administrators, they could strike at any time after that. Of course, negotiations are still ongoing, and so this strike could be averted. We're live here in North Philadelphia. I'm Greg Argos, CBS 3 Eyewitness News.
And I know you'll keep us updated, Greg. Thank you.